So, based on the scenario I provided, we're walking out to the plate to find the baseball player, the hitter, who was up to bat, just got hit by the pitch, and he's holding his jaw on the left side. So once we get there, we see it's kind of down here, and we look at him. We try to take his hands off his face and get him looking up at us so we can walk him off the field as soon as we feel it's fit. But initially, start to see some swelling and potential for signs of deformity, but nothing obvious that stands out to us. So we start to palpate, start away from the site. So we're going superior orbital to the lateral orbital side, and then we'll go inferior. Then we'll come in to the nasal cartilage and the nasal bones down here to see if anything shifted or caused external forces which would have further injuries to our athlete. Then it'd come in to the side, to the zygomatic bone, work superiorly or inferiorly to the maxilla. And we'd go back out to the TMJ joint and see if we could feel anything there. And then at this point, I'd go with my right hand on his right side, lightly palpating his mandible to see if we could feel any obvious signs of deformity or step-off deformity on the right side due to the impact. But nothing is there. That's good. So then we go on the left side, and I start to notice after palpating the masseter and then just distal to the buccinator that we feel a slight step-off deformity and a little bit of crepitus when I push into it, and it causes pain that's localized in that area. So after that, try to have the patient open his mouth to see how far he can get it open and then close it too. And it looks something like this. And like that. So with his mouth open, as far as he can go, he's not really compliant in doing it. He doesn't like to do it because it causes pain. So we're going to try to I'd pull out his cheek and kind of look at the tooth alignment. And then press on any of his teeth as much as I could to see if anything were avulsed or loose, to see if we have any other complications in his mouth additional to the suspected mandible fracture. So we find that he does have a malocclusion of his teeth, which is a sign of another sign of a mandibular fracture. And then we're going to go on to our special test, which we skip manual muscle testing because it's contraindicated due to the step-off deformity and then the possible fracture. And then the only special test that we could use for a mandibular fracture would be the tongue blade. In this case, probably wouldn't do the tongue blade because we already have enough evidence and enough visual and palpation evidence that we're just going to refer him anyway. But if we wanted to, I'd have him get a tongue depressor in his mouth just past the teeth, and then have him bite down on it to see if it caused any pain or if he could hold it. So once he was holding it like this, we'd wiggle the tongue depressor and then try to pull it out too to see if he still had strength or any if it caused pain when we did that motion. We would find that it would be positive based on our previous findings. And then we'd, while he was there, probably take a look at his eye movement. So we're looking at the optic nerve, the ocular motor, the trochlear, and then the abducens too. So might as well while we're there. It doesn't take much. So we're going up, and then we're going down, keeping his head still and just using his eyes to follow. See if there was any damage there. We're going diagonal as well. And all the way down like that, and then we'll go in. Once we finish that, we find that his cranial nerve 5, which is his trigeminal, is damaged because due to the pain and step-off deformity in the mandible. So the muscles of mastication, it hurts him to bite down, as we saw when he tried to open and close his mouth. And then the cranial nerve 7, which is facial nerves, so asking him to smile or asking him to frown or laugh or something that would cause his face to move in that in any direction was painful as well. So those were the two main nerves that were affected. The other ones passed the eye movement. At that point, you wouldn't really need to do the rest of them. I'd probably have him swallow to see if he could still use like the muscles around his throat and to see if anything wasn't like lodged or stuck or impaled due to the fracture. But that would come out negative, and then I'd use some Powerflex or an ACE wrap or something to wrap around his jaw while he was closed, like that, and then I'd probably go around his head as well, to kind of secure it while we refer him out to his or the team orthopedic physician, if that was available, or just his physician or ER, so we could get a further evaluation.